Heart rate variability, HRV, describes the time variability between successive heartbeats controlled by the autonomic nervous system, ANS. HRV is usually measured using an electrocardiogram, ECG, or other heart rate monitoring device. The higher the HRV, the higher the flexibility and adaptability of the autonomic nervous system. A lower HRV can be a sign of physiological or psychological stress. HRV is associated with a variety of health outcomes, including cardiovascular disease, diabetes, anxiety, depression, and overall mortality. A lower HRV is associated with an increased risk of these conditions, while a higher HRV may signal better overall health. A high HRV is generally considered a good thing, as it improves your overall health and increases your resilience to stress. Research shows that a higher HRV is associated with better cardiovascular health, better cognitive function, and lower risk of death. A higher HRV is associated with better emotional regulation and a reduced risk of anxiety and depression. On the other hand, a low HRV is associated with an increased risk of several health conditions, including cardiovascular disease, diabetes, and mood disorders. A low HRV can be a sign of chronic stress, poor sleep, or other factors that throw the ANS out of balance. So in general, it's a good idea to try to increase your HRV through lifestyle changes like regular exercise, stress management, and healthy sleep habits. HRV monitoring can also be a useful tool for assessing overall health and identifying potential health risks. Can you make your heart beat 5 more times? Can I get more male hormones out? It's not possible. It's easy to think of nerve pain and numbness. However, the neural circuit is also shared with the motor nerve. In particular, it also controls the internal organs. The heart, lungs, intestines, liver, urine, feces, hormones, sleep, immunity, and body temperature control are things we do not actually control. The autonomic nerve is a conductor-like nerve that perfectly controls those functions that are self-tuning within me. The autonomic nerve seems to have no substance, but it is a very important treatment point that has substance. Autonomic nerves are wrapped around the back and thoracic spine. An autonomic nerve test is a type of diagnostic test that evaluates the function of the autonomic nervous system. Autonomic nerve inspection is recommended to be done together with X-ray pictures and autonomic nerve inspection. These tests usually involve measuring changes in heart rate, blood pressure, and other physiological parameters in response to various stimuli, such as changes in posture or breathing. A higher HRV indicates greater flexibility and adaptability of the ANS. Autonomic testing helps evaluate the function of the autonomic nervous system, ANS. Patients suffering from diabetes, Parkinson's disease, syncope, or orthostatic tachycardia syndrome can benefit from an autonomic nerve test. If you feel that your body is not recovering well, be sure to have an autonomic nerve test. Depending on your specific medical condition, your doctor may refer you to a neurologist, cardiologist, or other specialist. Although it is an abstract concept, there is a test that directly checks the autonomic nerve. Measuring how the heart beats changes is called a heart rate variability test. When we breathe quietly, our heart seems to beat the same way, but when we breathe in, the heart rate slightly speeds up, and when we exhale, it slows down slightly. Heart rate variability is a test that measures how much the heart rate changes during breathing. It is difficult to make an accurate judgment with a one-time test, but it is possible to identify trends. Most chronic diseases, strange diseases. When looking at diseases that are chronically unresolved, diversity disappears and graphs are often clustered in one place. Therefore, it is important to observe trends while observing diversity indicators. If we compare that trend with each other through the flow of the spine and X-rays, it is somewhat correct. An autonomic nerve test is a helpful test as an auxiliary indicator. So far, we have learned about how to check HRV. We mentioned earlier that a high HRV can be a sign of better overall health. So what can you do to increase your HRV? There are several lifestyle changes that can help you increase your heart rate variability, HRV, and lead a healthier life. 1. Regular physical activity, especially moderate-intensity aerobic exercise, has been shown to improve HRV. Aim for at least 30 minutes of moderate intensity exercise like brisk walking, biking or swimming most days of the week. 2. It is good to practice deep breathing or meditation. Deep breathing and meditation can improve HRV by promoting relaxation and helping to reduce stress. Try slow, deep breathing, guided meditation, or relaxation exercises for a few minutes each day. 3. Get enough sleep. Getting adequate sleep is important for overall health and may even improve HRV. Aim for 7 to 8 hours of sleep each night and establish a regular sleep schedule. 4. Stress management is important. Chronic stress can lower HRV and increase your risk of heart disease. Find healthy ways to manage stress through exercise, relaxation techniques, and talking with trusted friends and family. 5. Eat a healthy diet. A diet rich in fruits, vegetables, whole grains, and lean protein can help improve HRV and overall health. Avoid eating processed foods, sugary drinks, and excessive alcohol. 6. Avoid smoking and limit your alcohol intake. Smoking and excessive alcohol consumption can lower HRV and increase the risk of heart disease. If you smoke, consider quitting and limit your alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. Thanks for watching.